Welcome to the training on infection control and COVID precautions. To demonstrate proper infection control techniques, including COVID precautions, to protect both care recipients and caregivers from the spread of infections. Preventing the spread of infections is critical, especially in healthcare settings. This training will cover key infection control practices and specific measures related to COVID. Hand hygiene. Washing hands. Wash hands with soap and water for at least 20 seconds, especially before and after care recipient contact, after using the bathroom, and before eating. If soap and water are not available, use hand sanitizer with at least 60% alcohol. When to wash. After touching surfaces, handling waste, and before and after using personal protective equipment. Personal protective equipment. Masks. Wear a face mask when providing care, especially if the care recipient is ill or during an outbreak like COVID. Ensure the mask covers both the nose and mouth and is fitted snugly to prevent gaps. Gloves. Wear gloves when touching bodily fluids, providing personal care, or cleaning. Change gloves between tasks and wash hands after removing them. Cleaning and disinfecting. Regularly clean and disinfect frequently touched surfaces, such as doorknobs, light switches, and medical equipment. Use appropriate disinfectants, following the manufacturer's instructions for contact time and safety precautions. Ensure items like wheelchairs or walkers are disinfected between uses. Handling waste. Dispose of contaminated waste, such as used PPE, tissues, and medical supplies. COVID-specific measures. Screening and monitoring. Screen care recipients and yourself for COVID-19 symptoms, such as fever, cough, or shortness of breath. Monitor the care recipient's health and report any symptoms to a healthcare provider immediately. Isolation. If a care recipient is suspected or confirmed to have COVID, follow isolation protocols, keeping them in a separate room with minimal contact. Use dedicated equipment for COVID-positive care recipients and avoid sharing it with others. Thank you for completing the infection control and COVID precautions training. By following these practices, you can help protect yourself and your care recipients from infections and ensure a safe environment for everyone.